Can we now recognize the welfare of children?
Sir. Mr. Chair.
Yes, you say.
Again, good afternoon. I'm Yusek Angelo Tapales from the Council for the Welfare of Children. Mr. Chair, we have submitted an initial position paper on the pending House bills, but given the discussions and the healthy discussions that transpired today, we undertake to submit a supplemental position paper so that we can lay down our position. Mr. Chair, 40.4% of our population belongs to this 10 to 19 bracket that the House bills are targeting. While we agree, of course, with our colleagues from the Population Commission and other resource persons that the incidence of adolescent pregnancy has somewhat dipped, we also agree with them that this fact might entail or should engender further study because it might be artificial. In any case, Mr. Chair, at the Council for the Welfare of Children, whether this is artificial or not, the numbers of pregnancy for children between 10 to 14 years old is still very alarming. That's why we support the pending bills, of course, with our comments on some provisions, Mr. Chair. In addition to what the Population Commission stated earlier, that this is really a pressing problem, a population problem, taking off, of course, from the comments of our former Undersecretary, Congressman Mitch Cahayon-Uy, when she mentioned about the Barangay Council for the Protection of Children. In fact, Mr. Chair, the position of the Council for the Welfare of Children, the issue of adolescent pregnancy, Mr. Chair, is not just a population concern. It's also a child protection concern. Because based on the data that we have from the Council for the Welfare of Children, more often than not, one of the major concerns of adolescent pregnancy and birth is violence against children. More often than not, underage mothers or minor mothers, their kids are generally sired by adult or older fathers. So there is really a protection complexion here. That's why one of our comments in our position paper that we undertake to submit is to strengthen the local protection council for the protection of children in the LGUs as well as the BCPCs at the barangay level. In particular, Mr. Chair, in the House bill filed by Honorable Vargas, there is an integration, there is a local program for the prevention of adolescent pregnancy, which is very laudable because we have to have a comprehensive program to address adolescent pregnancy. For the Council for the Welfare of Children, since there are existing councils like the LCPCs and the BCPCs, maybe it's also worth taking a look or checking if this program can also be cascaded to these existing structures so that they can also implement it. Because there are already existing structures, Mr. Chair. Furthermore, Mr. Chair, with respect to the Adolescent Pregnancy Prevention Council, of course, we support that. However, Mr. Chair, one concern from the Council for the Welfare of Children is how this Adolescent Pregnancy Prevention Council will interact with existing structures under previous regulations or laws, like the National Adolescent Youth Health Development Technical Working Group, the Adolescent Sexuality and Reproductive Health Technical Working Group, and the National Implementation Team of the RP, Responsible Parent and Reproductive Health Act. So what we are saying here, Mr. Chair, is that while the purpose of establishing an Adolescent Pregnancy Prevention Council is very admirable and laudable, maybe we need to check how this council will interact with existing structures to prevent duplication, confusion, because if that happens, of course, there's a possibility that nothing will happen because each council or body will just point at each other on who will be implementing this particular interventions contained in the bills, Mr. Chair. Another, Mr. Chair, is there is a mention about a national program of action and investment plan for the prevention of teenage pregnancy. For the Council for the Welfare of Children, Mr. Chair, we propose the revision of the term teenage pregnancy to adolescent pregnancy, because if we will check the definition of adolescents in the House bills, it's 10 to 19. So 10 to 12 is not really teenage, strictly speaking, Mr. Chair. So maybe we need to clarify that just to be consistent. Another body to be created under the House bills is the Information Service Delivery Network, Mr. Chair. That's also an admirable effort, but we also need to check how this Information Service Delivery Network will interact or coexist with the existing service delivery network on adolescent and health development program, because I think the DOH, and maybe the DOH can also confirm this or discuss this in their position paper. They have an administrative order number 2015-00, 2014, sorry, -0046, defining the SDN for the universal health care and department care. And there is also a DOH Department Memorandum 2014-0313 adopting the general guidelines for establishing SDN. So maybe we should also take a look how this Information Service Delivery Network envisioned in the pending bills will interact, coexist, or how we can harmonize it with the existing structures. There is also, Mr. Chair, a mention of local teen centers for adolescent health and development. We also support that, Mr. Chair, but we caution or we advise that there may be a need to check how these local teen centers for adolescent health and development will coexist or will work with the existing adolescent-friendly health facilities of the DOH, because currently, as of October 2020, there are 704 adolescent-friendly health facilities all over the country. So maybe we have to check also, Mr. Chair, to prevent duplication and confusion. And the social protection provisions of the bills, we strongly support it. As I mentioned earlier, it's not just a population concern, it's also a social protection or protection issue. It's about protecting children also. So we welcome that, Mr. Chair. For now, Mr. Chair, that's all for the Council for the Welfare of Children. Again, as I mentioned earlier, we undertake to submit a supplemental position paper. Thank you, Mr. Chair and members of the committee.
CWC, may we have an idea of your organizational structure and if you have regional offices to cascade your programs?
Mr. Chair, Honorable Congressman, the Council for the Welfare of Children was created in 1975 through PD 1603. It's a December 1974 law. We are the focal or apex agency about children. We are under the DSWD. We're an attached agency. We are the policy-making arm of the DSWD concerning all matters relating to children. The Council for the Welfare of Children Secretariat, which I head as Undersecretary, is the Secretariat of the Board, which the DSWD Secretary serves as chairman. We are a policy-making body under the DSWD, Your Honor, Mr. Chair. And we have regional committees and subcommittees. We have regional coordinators and personnel, which is housed on the regional offices of the DSWD. So, thank you, sir.
Thank you, Yusek.